Hi, this is Ritvik Sharma. Welcome back to my channel Simplified Psychopathology. So we are starting a new crash course on Introduction to Cognitive Behavioral Therapy in this summer break. So in this course, we will talk about what is cognitive behavioral therapy and how we can use cognitive behavioral therapy to help patients with mental disorders. So cognitive behavioral therapy basically works on the cognition of the patient or the client, which who are facing problems with mental disorders. And after working on the cognition or the mind or the thoughts, we can work upon the behavior of the patient, and then we can work upon the automatic action which he or she is taking after that cognition, after that mind or the negative automatic thoughts. Okay, so cognitive behavioral therapy work upon the thoughts which you're having, the automatic thoughts which you're having after some situation, and then we change those automatic thoughts to those negative automatic thoughts to less negative automatic thoughts, and after that we can work upon the anxiety, depression, and other problems which we are having. Okay, so it can be the negative automatic thoughts. So like if I'm going through a breakup, I would feel lonely. I will feel down about it, but I'm afraid to make new friends as well, to make new people as well. What they will learn, I will also think what they people will think about me, because I am going through a breakup. And also it can be like the partner, the last partner which we are having, which we would be having, because of the last partner, it can be grief, it can be other emotions which we are having. We will not be able to meet new people, make new friends, and these are the negative thoughts which we have because of some situation. And to change these negative automatic thoughts, we can use cognitive behavioral therapy. These negative automatic thoughts can be changed, like we can work with the clients and patients, and we can ask them to meet new people, and we can change these negative automatic thoughts by asking them to make new friends, to make new, to just meet new people, start a conversation with new people, and slowly and gradually build a relationship or build a friendship. And then please understand the people, and then overall do the relationship setup, and then take your time in making relationships. That is what we can do. Okay, and so these are the depression and anxiety problems, like if somebody died in your family, and if somebody is having a problems with friendship or having problem in talking to your family members, like in this Indian culture setup, people, the children have face problems to talk to their parents, because sometimes the parents are strict, so they are not able to talk to their parents. So they're not able to share what is happening with also. So cognitive behavioral therapy can be used because the children are facing problems with anxiety, depression, because they are not able to share their thoughts to parents because they fear from them, they're frightened from them. So using cognitive behavioral therapy, we can work upon their negative automatic thoughts, like they're not able to share those things, so they can share to the parents and talk about it. And so that would be very this cognitive behavioral therapy can work upon it. So cognitive behavioral therapy is basically focus on changing the automatic negative thoughts that can contribute to worsen our emotional difficulties, depression, and anxiety. These spontaneous negative thoughts also have a detrimental influence on our mood. So if somebody is facing some negative automatic thoughts, it will lead to depression and anxiety. And also, if that negative automatic thoughts can be worsened, and because of the emotional difficulties, and that negative automatic thoughts is not changed, but that will lead to depression and anxiety. About 1 out of 5 people in the whole world face these problems of depression and anxiety, and this depression and anxiety can lead to a serious mental disorder as well, like bipolar disorder or any other disorder as well. By using cognitive behavioral therapy, we can work upon those negative automatic thoughts. So in this course, or the crash course about the introduction of CBT, we will talk about the cognitive distortions, how to use cognitive behavioral therapy in these mental disorders, and how to work with every single client. I will talk about that. People facing disorders with eating disorders, okay, and it can be like mental disorders, any mental disorders, and how we use cognitive behavior. It can be work upon relationships problems as well, like couple therapy can be done with cognitive behavioral therapy as well. Family therapy can be done with cognitive behavioral therapy soon. If there's a problem with the family, if there are issues coming in, so the cognitive behavioral therapy can help resolve these issues. So in this course, we will talk about that. So it's a psychotherapeutical treatment that helps learn how to identify and change the destructive or disturbing thought pattern, because that thought pattern is destructive, like OCD, in which we have the compulsion of those thoughts which are coming. Okay, and that compulsion of the thoughts are coming and going there in a cycle. And in that cycle of depression, and then that cycle, it can lead to depression, it can also lead to anxiety, and it can also lead to other mental disorders. To break that cycle, we can use cognitive behavioral therapy. So this is all about the introduction of cognitive behavioral therapy. In my next video, I will talk about how to work with cognitive behavioral therapy, how we set the goals to work upon some kind of issues, and how we will work upon cognitive behavioral therapy to help resolve the issues of our patients or the clients. Thank you.